Can everyone see the slides okay?
Yes, I think so.
Perf- Perfect. Great. So today, in honor of Heart Health Month, we're going to focus on reducing and reversing the setup for heart disease. Those setups are things in cardiovascular and metabolic realms. And so they're called cardiometabolic risk factors. They're the things that drive heart disease. Heart disease isn't just a condition by itself, it is supported by other conditions that can be prevented, reduced, or even reversed in order to reduce heart disease. So that's the opportunity area that we'll be diving into today. Thank you for your attention. In advance, I'll tell you I have a lot of slides, but I will go through them very quickly and I will stay until all questions are answered if there are questions. And obviously, during an educational time that we share, this is not meant to diagnose or treat individual situations. And I don't have anything to disclose. My background is in medicine, nursing, and bodybuilding. I combine all of those to make my practice today in lifestyle, specifically bring in bodybuilding knowledge and as a professional bodybuilder, helping others to fix their bodies the way they like, add the health aspect to that. And that's where lifestyle medicine for me became the natural specialty. As an intensivist, I am what they call a transformation specialist. I take people from point A and guide them to point B through nutrition and lifestyle changes, and usually getting rid of disease, medication, or whatever they want to shed, whether that's related to disease or just body composition. So I do bring both my personal healthcare experience and medicine, as well as nutrition, into what I do every day, and it's my passion to share it with you. Lifestyle medicine is new. It is a specialty of medicine that is the newest, possibly. It is an evidence-based specialty that uses nutrition, exercise, avoiding toxic substances, connecting with other people like we're doing tonight, stress management techniques, and optimizing sleep to fix the life. Basically, when someone is diseased, most of the time with a chronic condition, one of these six pillars is impaired or missing altogether. We can remember that stress can cause disease, lack of sleep can cause disease, having very difficult relationships can cause disease. And so these pillars are what we establish when we help someone get healthy again with lifestyle. This type of specialty was really founded in about 2004, so it's just over 20 years old now. And you may see more and more lifestyle physicians in the future. But our aim is to transform the current healthcare system into a more sustainable one so that we're not continuing to see more pills and more diseases as we are seeing today. More and more procedures and pills, and more chronic conditions, and more people dying of heart disease every year. If you didn't know, despite COVID taking a lot of people over the course of the 2020 years, heart disease remained the number one killer, even at the peak of COVID. Heart attacks, or heart failure, or any of these other conditions like stroke, diabetes, chronic conditions leading to heart disease. So this is the reason we talk about heart health for an entire month out of the year, because it's the one that's killing us the most. If you think of a day, just today in the talk right now, there will be about one person every 40 seconds who will suffer a heart attack during the course of a talk in the United States. So if for the whole day, that may be 2,000 people who have a heart attack, and half of these people don't make it. So 800,000 people a year have a heart attack in the United States. How many die? One out of every three women who have cardiovascular disease die every year. And right now, the disease is so common that if you have three men together, you can think that possibly the chances are that two of them have cardiovascular disease out of the three of them standing there. So I mentioned that it is the one that is the highest in terms of killing Americans every 40 seconds. And this is the reason why our attention is on this condition. What are these factors that lead to heart disease? Remember, I mentioned that the heart disease is not a special bucket in and of itself. There are many things that lead to heart disease, and they're listed right here. The risk factors is what they're called. What are those risk factors? Obesity, physical inactivity, which, by the way, now is a risk factor for high blood pressure. If you have high blood pressure, not many people smoke anymore, but if that's in the picture, it can make the blood vessels stiffened, which can increase blood pressure, which can lead to heart disease. High cholesterol, most people associate high cholesterol with heart disease. And diabetes, perhaps some of you may not have thought of diabetes as a risk factor, but when we think of cardio, the cardio risk factors in here are the high blood pressure, cholesterol, and the metabolic risk factors in here are the obesity and diabetes. Those are the four things that I will focus on for today's talk. So if we look at what leads to heart disease, this is the reason why they say 80% of heart disease is reversible. So it's diet or habits, high blood pressure, which is often fixable or reversible or controllable, lack of movement, obesity. Sometimes alcohol use over long periods of time can stiffen the blood vessels, so that's why it is in there. And abnormal cholesterol, we know blood sugar, which perhaps we wouldn't think of, but diabetes leads straight to cardiovascular disease and mental stress. Lifestyle is the avenue by which we say 80% preventable, not with a pill. Preventable means before it even begins to cause symptoms or need to be medicated. There might be signs of obesity, diabetes, blood pressure, or cholesterol. When those are showing up early in life, perhaps even in our 50s, that's the time where prevention can be active. Anytime after that, it's called disease reversal. So everyone in here and watching should know their risk of heart attack or stroke because it can be calculated. And I'll show you quickly how to do that. If you go to Google and put in ASCVD, it stands for atherosclerotic cardiovascular disease. It's a calculator that will show up. There's few of them. I use the one by the American College of Cardiology, so ACC or AHA, American Heart Association. You'll plug in your age, your gender, your cholesterol total, the good cholesterol, that's called the healthy or HDL. Plug in your blood pressure, put in whether you have diabetes or not, and it gives you a number. It's that simple. Many people now don't know this risk, but it can be calculated. Many doctors used to do this, but it's not done now with the 10-minute visit. But you can ask your doctor to help you calculate your risk of heart attack or stroke. I put in this example here for a patient of mine that I'll show you. He was 60, white, 193 was his total cholesterol, HDL was 48, blood pressure was 190 at the time. He's much better now. And he was on medication for blood pressure, did not have diabetes, and was not a smoker. So we hit calculate and we get a number. When you get that number, when you hit calculate, I'll show you how to interpret it. If it says 19%, that's very high. It should be less than 5%. Okay? This risk calculated compares your number to a similar patient with optimal risk factors. What does this mean? The same age, same demographic, but if that person fixed their blood pressure, cholesterol, diabetes, or obesity, perhaps their risk would go down. That's exactly how we can say 80% of heart disease is preventable. So same patient, same demographics, but one with risk factors that are optimized and one with risk factors that maybe they didn't think were connected to heart disease that are not optimized, walking around with a very high risk of heart attack or stroke in the 10 years ahead. So that risk of 19.3% fell right here in the intermediate, and that person would have required a statin. Now, he wasn't able to tolerate that medication. This is the reason why we work together. And he did bring down his risk, But some people, if they don't know what to do with lifestyle, do require medication. If your risk falls anything above 7.5, it is time to speak to your doctor. You are at risk for cardiovascular disease, and you can find ways to reduce it as we will discuss here. If there is obesity, if there is high blood pressure, if there is high cholesterol or diabetes, you are in luck because those things are manageable and reducible and they funnel directly into heart disease risk, okay? So find out if you have risk factors. And if one of those risk factors is blood pressure, know that blood pressure often is forgotten. It's in the background. It doesn't cause pain. Sometimes there's no symptoms. It is the deadliest of all those risk factors that I mentioned. Out of obesity, cholesterol, diabetes, and blood pressure is the one that actually leads to more deaths. So this is a quote. In the United States, hypertension accounts for more ASCVD, atherosclerotic cardiovascular deaths, than any other modifiable risk factor. What's modifiable? The thing you can fix, like the cholesterol, the diabetes, and the obesity. So if blood pressure exists, consider it a red flag and it needs attention immediately. And this is the reason they call this the silent killer. If the blood pressure is over 120, it is elevated. A lot of people think a blood pressure of 130 is okay. It is not. It is at risk. So if you have 130 over 70, that's stage 1 high blood pressure. Okay? And that can be affecting the kidneys over the long term, even though there are no symptoms for 10, 20, or 30 years or more. A lot of people wait until it's much higher to seek attention or to do something about it. But a lot of times by 10 years of very high blood pressure, a lot of kidney function has already been lost. And that's sometimes a little bit late for the kidneys. 130 is too high. About half of the US population suffers from high blood pressure. So check your pressure. If you don't know your number, stop at a Walmart or Walgreens or a store, get your number. If you find that it's high, buy a machine and keep one at home because in the comfort of your own home, you may get more accurate numbers. This is more common in men than in women, but it is underdiagnosed in women. And it happens a lot in the non-white population. So among Black men, for example, high blood pressure is the highest prevalence in the world, on the planet. Black men die younger from cardiovascular disease for many reasons. They're 3 to 4 times higher at having kidney failure, likely related to the cardiovascular disease and high blood pressure for a long time. They're more likely to be on dialysis and have an earlier onset of diabetes. So there's not a genetic predisposition for this for Black men. They do have a lot of very complex social, family, financial, and other situations that put that can impact decision making around health. See a lot of Black men who delay taking action early for health because they may be busy, they may be working, they may not have that as a priority, they may not have the budget for it, they don't dedicate the time. So a thought that this may be all genetics is a little bit not considering all these other systemic factors that go into all of the diseases that some populations carry. So cardiometabolic conditions that Black men carry, like high blood pressure, cholesterol, heart disease, high stroke risk, metabolic syndrome, prediabetes, obesity, visceral fat, all of these are addressable with lifestyle. Similarly, Black women often are overburdened by inflammation, obesity, autoimmune conditions, chronic fatigue, long COVID, and these also funnel into heart disease because inflammation is one of the hidden risk factors for cardiovascular disease. It's kind of like having diabetes. It affects the entire system and the whole vasculature becomes more friable, more susceptible to damage when there's inflammation. Again, this is a place where approach with lifestyle can help. If we're thinking proactively, this can be improved and heart disease can be reduced. In Black women, hypertension or high blood pressure is also high. It is often underdiagnosed. Black women still die of cardiovascular disease as the number one cause of death, and they have a high burden of obesity, type 2 diabetes, and fibroids. Again, this is not a genetic gift that Black women come with. There are many, many environmental, societal, systemic pressures that lead to what we're seeing in the medical field. There's a lot of delay that happens with health decisions. And again, this is not a simple explanation. It's usually laden with very complex social, environmental situations that our Black women are in. So celebrating heart health now with specific ways to reduce and examples of those reductions of the risk factors. I will show you that with lifestyle medicine, we don't prescribe pills. We do de-escalate pills if possible. And so we address the root cause, which are usually related to nutrition, movement, mindset, stress, habits. And so what we accomplish when we have a transformation is a long-term success where a person becomes a new human being with new habits, a new way of thinking. Okay? Our aim is to reverse disease or to reduce the burden of disease or to prevent disease. Our final goal is to establish actual health without medication or without excess medication. So as an intensivist, I have the job of doing this at a very uh, intense level, if you will, where people are needing to have disease intervention for serious conditions or multi-complex conditions, multiple conditions. And we usually work for 4 to 6 months. I work for 4 to 6 months on someone to get them before and after labs that are almost completely resolved, if not improved. Okay. So we work with type 2 diabetics, high blood pressure, cholesterol, and obesity, among a lot of other conditions, but we will focus on those for this talk. And as I mentioned, we want to restore health. So let's take the first condition, that is the silent killer, high blood pressure. 60-year-old man that I mentioned earlier came in with very high blood pressure. He had cholesterol as well. He wanted to get better. He was already on blood pressure medication. He couldn't tolerate the statin, even though he needed the statin for his cholesterol. His blood pressure was 190/100. His BMI, which is an average of the height and the weight, was 36, which is high. It should be under 25. And his waist circumference, you can see down here, was 42 inches. So at 232, 42-inch waist, 190/100, and BMI 36, we had some work to do, and we went to work. A lot of other conditions show up with these issues, usually poor energy, sleep apnea, metabolic syndrome, circulation issues also. So we did some advanced labs and found that he had high inflammation, high insulin resistance. He was actively laying down plaque, and I mentioned we had calculated his risk before. So in addition to the basic labs, the advanced labs give us what's underneath the tip of the iceberg. So I found inflammation, insulin resistance, high visceral fat, plaque buildup, and also some genetic predispositions. The reason why I don't personally rely just on the basic labs is because it is limited and doesn't give me as much opportunity to reverse certain things that are the root cause of what we're seeing up here, the high blood pressure, cholesterol, and diabetes. Okay. A lot of times, by the time the basic labs become abnormal, it's a really very well advanced condition. So initially, he was 232 pounds. So he started losing weight to 20 to 27. His BMI and visceral fat were high. And he also was older than his actual age, 67, when he, in fact, his body thought it was 67 when he actually was only 60. So his cholesterol was like this, 193, which is not bad when you look at just the basic labs here. You can see that 193 is under 200, so it's green. You can see his LDL is 121. Someone might say, okay, that's not too bad. But if you look at the advanced labs, you can see, wow, there's something going on here. These are the hidden risks that are revealed when someone is able to get advanced labs. So this is why I don't personally rely on basic labs for cardiovascular disease and metabolic disease um, treatment. So with this lab, what I learned is that he was making the wrong types of cholesterol. His type of cholesterol was small and sticky and more likely to stick to the lining of the vessel, more likely to cause plaque, and more likely to be dangerous. He had a pattern B, which is called a more dangerous pattern. So we also saw that he had active plaque deposition, and advanced metabolic markers showed that he did have insulin resistance, which was very high. And I mentioned that his risk was calculated at 19. So we went to work, and here's what happened. We simply started nutritional coaching because he was willing, he cooked, he had family support. He lost 39 pounds with coaching. Okay, this is over the course of 2 to 3 months. And he went from 232 to 193. Visceral fat went from 18 initially to 13. And what you can see here in these markers is that his body composition improved. Okay, so this is his visceral fat, which is 13 now. His weight, 193. His BMI, and his body fat. So his blood pressure also improved from the high that it started with to 122/78, which is much better than 130 or above, as I mentioned. Just with nutritional intervention, these results happened. So in fact, his blood pressure medications, which had been multiple, had to be decreased. And he continues to maintain that progress to this day. This was back in 2022. After his nutritional improvement and body composition improvement, we also saw that his cholesterol also looked beautiful. Remember, I mentioned the underlying risks with advanced labs being very scary? Well, at the end of his process, he had very improved quality of cholesterol. Not just that the quantity was lower from 193 to 157. LDL went from 121 down to 84. This was the basic cholesterol improvement, but look at what happened to his advanced lipid panel. He went from an undesirable pattern to a much healthier cholesterol pattern. So even the quality of the cholesterol that his body was making improved. This you don't see by being on a statin, unfortunately. And I have observed in my practice that some people who take the statin, the top numbers get really, really nice, but if their lifestyle doesn't change, they continue to make highly dangerous cholesterol, which is how we explain some of the people who still have a heart attack while they're taking their statin. So it sometimes can be a false sense of reassurance and allows people to continue with certain habits that actually continue to get them sick while they're on the medication. So this gentleman truly got healthier and his cholesterol improved in quality as well. His metabolic health also improved without an additional pill. He reduced his insulin resistance, his nutritional status improved, his omegas went up, vitamin D went up. He was almost pre-diabetic. Look at his A1C at 5.6. It was improved to 5.3. His fasting insulin went from double digits down to 6. So lifestyle really is a way to approach systemic, interrelated, interconnected conditions and affect all of them in a positive way with one change, which is the lifestyle. So everything was either solved or improved in the problem list that he came to us with. So cholesterol, activating plaque, blood pressure, obesity, nutritional deficiencies, poor energy, metabolic health, and insulin resistance. No new drugs, but a lot of improved health. So this is the first example to show you that even in the case of a very severely elevated high blood pressure and multiple cardiac and metabolic derangements, lifestyle approach can address all of those interrelated conditions and reduce the total risk, which is what we did this for. We wanted to reduce his risk from 19 down below. So if you plug in the new cholesterol that he has in the new blood pressure, you get a much lower risk, and that's the way that we improve prevention with lifestyle. Like this patient, many people come with combined. This person, 66-year-old female, excuse me, came in with prediabetes, high cholesterol, and blood pressure. So you don't often find in isolation. There might be weight, there might be blood pressure and weight. There's usually combinations of the conditions. And so in her, you see an elevated A1C, cholesterol, elevated BMI, blood pressure. She's on a few medications. So again, we took some advanced labs, found out that she had inflammation, and found out that she had a very high homocysteine, which is another marker of cardiovascular disease and metabolic disease. We also found that she had very low omega-3. So these are opportunities and gaps in her nutrition that can easily be filled and supported so that we improve heart health regimen. So after lifestyle therapy, which is usually about 8 to 12 weeks, here's what happened to her. Remember, she was 66. She started at 166.8 pounds. And you don't need to lose a lot of weight to get health benefits. But most people would like to lose some weight. So she started at visceral fat of 13. After 4 weeks of work, she was down to visceral fat of 12. And then after 8 weeks, she was down to 11. And in that span of time, she lost a few pounds. She, more importantly, reduced her blood pressure from the 130s down to the 110s. That's the main point of her story. Because the blood pressure is such a deadly risk factor, it's important to make sure that during any process that involves lifestyle, that it's addressed. It's not just about weight loss. Some people lose weight and still keep the blood pressure. It has to be a healthy weight loss. And you see that with the health markers. The blood pressure went so low that her medication did have to be discontinued. Some of them were discontinued and some of them were decreased by half by her primary care. So that's the success story of someone who is doing it right. So lifestyle physicians can partner with primary care and other specialists to get patients healthy. And it's important to know that they're not taking over your primary care services. So this female did have inflammation, high cholesterol, and after her lifestyle regimen, she had a perfect looking cholesterol and no inflammation. There was an advanced lab here called ApoB. For the purpose of this talk, I'll just introduce this item to you. If you have high cholesterol and the LDL is high, I'll just let you know that this number, ApoB, is now considered more important than the LDL. It gives us risk information that is more accurate and more telling of a heart risk than the LDL. So this is an item that I usually check in my patients. And in her, she did have nutritional deficiencies. B12 was 200, that improved. Homocysteine was 11, that improved. Omega-3s were very low and that improved. So it's not just about weight loss. Now, as an intensivist, we want to reverse, we want to establish health, we want to restore health. And we love seeing diseases go away. We love managing complex patients. I do. And this is what we went to medicine for. So high cholesterol, I'm going to fly through these next slides because now you get the idea that it's a complex case, but specific items get fixed along the way. One of those is cholesterol. This is the case of someone who had a very high starting cholesterol of 246. That went down to 161. No drugs, just food, some supplementation, and lifestyle changes. Her LDL was 168. That went down to 95. Incredible. No drugs. Again, the arteries are getting healthier, and she's learning how to actually maintain this as opposed to just taking a pill and never knowing and understanding how to get healthier. These are different examples of high cholesterols that are fixed, and this slide shows you that it can be maintained. This is not something that bounces around. You know, if you forget to take your statin and you go on vacation, somebody might have a heart attack. It's very dangerous because the cholesterol just comes right back up. But there's nothing to remember here because the habits are ingrained once the initial work is done. And so people normally maintain their results and they live in their maintenance phase without worry of a sudden issue related to their numbers going back up. Okay. So this is an example of someone who in 2024 had her process, reduced her cholesterol. And actually, when I saw her again late in 2025, she had maintained and even improved a little bit on her cholesterol without my working with her directly. So we can even de-escalate medication, as in this case, where somebody took medication and came to me, and then we had to reduce medication because his cholesterol went way too low. He didn't need as much medication. This is how we help in society with an over-medicated population that doesn't have enough knowledge about how to improve their own health. And so if we work with the specialists, even as the patient stays safe on the medication, when it's time, we can signal the de-escalation of medication when it's appropriate. And more importantly, as I mentioned, it's not just the basic top line cholesterol that matters, but the quality of the cholesterol. In this patient, you can see that he had a B pattern. Actually, this was a female, excuse me, 60 female. She had a B pattern that is sticky, plaque producing, dangerous cholesterol. And over the course of months of work, she started producing healthier cholesterol. That's also important. Okay. That very telling ApoB that I mentioned earlier that was more important than LDL, that also is improvable. So finding out hidden risks with advanced labs or with a thorough examination and consultation underneath the basic conditions like type 2 diabetes, cholesterol, and blood pressure is important, because if you can reverse the things that are underneath the iceberg, then it's easier to fix that tip of the iceberg as well. So know your risk and address the root causes. Now, I talked about high blood pressure, I talked about cholesterol, and I would like to transition to diabetes and obesity really quickly. So this person had the elevated ApoB, as you can see, that was very dangerous for cholesterol. That was fixed. She also had an A1C of 5.7, which is pre-diabetic, and that was fixed. Now, the combination of heart disease and metabolic disease is seen often. This is why this talk is called cardiometabolic risk factors. And so in the metabolic risk factors, prediabetes is the one that is more common, along with type 2 diabetes. And in the 67-year-old, prediabetes just took a few months to fix. So going from an A1C of 5.7 down to 5.4 doesn't have to take 3, 4, 5 years or a few decades. This is knowing what to do with expert guidance with nutrition. This is a 76-year-old female who took her A1C from 9.7 down to 7.4. She was motivated. She wanted to know how to do it. She had been trying on her own for a long time. So we finally worked together in 2021, and she was improved. Now, she didn't stop at 7.4. She said, I want to keep going lower. So she did. She did. So she went from 9.7 down to 7.4, and her A1C went down to 6.4. Currently, her A1C is even lower. However, when I put these slides together, we rejoiced at the 6.4. This is without the addition of new medication. And as you can see, even her insulin, fasting insulin went from 10 down to 7. So she improved her metabolic health as well. So what if these conditions like diabetes, high blood pressure, obesity were optional? Meaning you can decide if you want them or not. And when you decide that you don't want them, you can partner with someone and get guidance. People try hard and work hard on their own for many years. If there are no answers, then get guidance. So let's talk about the last topic, which is obesity. And weight loss is a fun category of a health project with guidance. It can be done alone, but if you want weight loss that indicates health, you need to have before and after labs, and you need to make sure that the weight loss is being done in a way that is also supporting health. Okay. Usually, a health supporting weight loss journey will look like an effective plan, consistency, no drugs, because we don't want to mess with appetite and our metabolism. Now, if there are food addiction and overeating issues, that's different. But if there aren't any, healthy weight loss can happen without drugs. That's the way we do it in our practice all the time. So it's a great thing to invest in. A lot of people decide to get a tummy tuck when we talk about weight loss. Let's remember that tummy tuck does not fix insulin resistance, fatty liver, or inflammation. Okay, mommy makeovers are great, but they don't get us healthy. This I learned when I prepared for this talk that millions of procedures like this are performed every year. And it was sobering and eye-opening because they are actually not covered by insurance and paid out of pocket. And so, what would be the comparison between the surgery and the lifestyle? Well, surgery does give you a better looking body, but lifestyle gives you that and health. Okay. So, a typical surgical intervention may be in the thousands, and someone asks about health insurance about every week when they reach out to me. Many lifestyle doctors don't currently take health insurance. Maybe that would change in the future. But there needs to be a budget if you're going to work with someone who is taking over the health aspect of your lifestyle journey. So we have many pills, we have many shots, we have many drugs, but obesity is still rising. It's important to note that it's not just rising in general, it's rising among children and adolescents. And it's the most severe type of obesity that is rising at the fastest rate. So we're beginning to see a future that looks worse than our present, even though there are more and more drugs on the market. Right now, almost 50% of the US population is actually obese. It's at 42%. And so we have to take stock in what's happening in our families, in our neighborhoods, in our communities, and in our population. The drugs haven't solved the problem. Why? Because we are targeting appetite. That's fine, but it's not the reason for the problem. Obesity is usually driven by many complex systems, including stress, sleep deprivation, processed foods, trauma, social issues, and the medications don't fix any of these problems. So when someone doesn't have the context to fix the root cause of why they're stressed, taking a pill to lose weight is just another thing that they're doing while they're remaining stressed. And this is the reason why I get calls from people who wish they'd never taken X injection because when the money ran out to pay for it, they gained the weight back and more. So it creates even more problems in some people, not everyone. So weight loss does not equal health restoration. Okay. So investing in our future, this is the final example. This is a 53-year-old woman who did have some obesity and she had a scare with a mini stroke and wanted to get healthier. She wanted to lose 30 pounds. That was her goal, improve the cholesterol and decrease inflammation. She started at 188 and visceral fat was 12. I always say that because it's the important fat, not the subcutaneous fat. The visceral fat leads to inflammation and is associated with disease. Her body thought it was 59, even though she was 53. So we went to work, and in the first week, she lost 6 pounds, which was good, but she was looking to lose 30 and get healthy. So we kept working. So in the first few weeks, this is week 1, 2, and 3, her visceral fat started dropping. Important to note here that her skeletal muscle was starting to go up. So you want to maintain or increase muscle during a healthy fat loss. This is something that most people don't think about or track when they're losing weight. In a first month, she went from 188 to 178. She dropped 10 pounds. Her muscle went from 36 to 38. The second month, she went from 175 to 170. And her visceral fat dropped from 12 to 10, now to 9. Her waist measurements, by the way, went from 35 down to 31. So dropping 28 pounds is great, but you got to know how to maintain it. And that is also a process. So these weeks are showing you the time that we actually connected and had counseling. and coaching. It's a worthwhile project because this information stays with the person for life. They can know how to navigate after the holidays or after vacation and get themselves back on track. So at the end of 16 weeks, which was 4 months, which is a little bit longer than I work with most people, she was motivated and was getting results the whole time. She lost 31 pounds. So 1 pound more than her goal. She journeyed for 4 months and has kept the benefits for years. So this is another person, not the same client that I just shared. This is somebody else who allows me to use her picture, and she is a healthy transformation. So this is to show you that you keep your muscle, you keep the integrity of your body. The process is done once, but it is also a lifelong experience that allows you to be empowered and learn how to get yourself out of similar situations in the future. Let's say you want to lose 5 more pounds when you're older, you can do that. So the doctor of the future will give no medicine, but will involve the patient in the proper use of food, fresh air, and exercise. This was said a very long time ago, and it's coming true finally now. So we had a lot of fun with pills and procedures for many, many decades in medicine. But because of the chronic disease burden, specifically with heart disease being number one killer that is 80% preventable, we just talked about how lifestyle medicine can help in that particular case. So we address heart disease through blood pressure, cholesterol, diabetes, and weight loss. And you've seen the cases that I shared. And I would love to take your questions. If you need to reach me, I can be reached at lifestylemedicinesarasota.com. And I specialize in health restorations, specifically cardiometabolic health restorations, with those examples that I showed. And I'm always happy to help people who are motivated. So this month in particular, we actually have a free jumpstart, which is a free nutritional guidance that I do once a week. And it started last night. And if anybody's interested, I can give them the link to hop on and see what we do. And maybe they can get a month of transformation with me during this month.
Wow, this was so helpful. I am so impressed. I really enjoyed this. I guess if anyone has any questions before I give mine, you can add them into the comments, or if you wanted to speak, there is I think there's a Q&A box at the bottom where you can raise your hand. But thank you so much, Dr. Ashby. That was amazing.
Amazing presentation. Thank you so much. Um, I had a question about the diet. My son-in-law just suffered a mild stroke a few weeks back from high blood pressure, um, and he just went and got established with a primary care doctor. But I'm interested in the diet part of it.
Good. It's a it's like saying I need food. So if there was a mild stroke and he's with a primary care, that's wonderful because he's connected to care. If
Hmm.
you'd like for his health to get better through nutrition, then it means he needs guidance because he got to that situation by not knowing. And
Right.
staying not knowing will last forever. This is why we have older people in their 60s who don't still haven't figured it out. So the main thing with the nutrition, even though it's food, it seems like we should know what to do. It requires weekly counseling.
Okay.
Now, if I'm going to give you a general answer, the general answer is going to be less red meat, less processed foods, more fruits and vegetables, which you might say, well, we already know that, but how do we get rid of the stroke risk? And that's where you get help walking the weeds. If you are interested in more specifics, this is why I do the free nutritional programming. It's an hour a week for 4 weeks, and it's free, and you can begin to learn the basics there.
Okay. Let me get a pen here. Excuse me.
So we have put the website that you provided in the chat, and so it's easily accessible for those viewing here in Zoom to click on it. And Ms. Ange, we of course will have the link, and we'll share that out also in our newsletter.
Okay.
So we'll have that there for your reference.
Okay.
Copy that. I'll put this aside so you can see it there. Okay. Does that conclude your questions, Ange?
Yes.
Okay. Anyone else with a question? Thank you so much. Okay. Well, then I'll give my, oh, someone is
Hey, how's everybody doing?
pretty good. Thank
Good.
you.
How are you?
Good. First of all, thank you, of course, for Dr. Ashby and offering just even the free nutritional at no cost, because I think, you know, you don't get that a lot. Anything free now. Like it's always attached with
You got that right.
something. But no, it was very informational. I'm just astonished by like even through COVID, that how heart disease topped deaths even through COVID, as bad as COVID was. I have a question. I'm just interested. I'm just curious to know among, I know you said like Black men, is that, are we more, like, is it more with Black men than like compared to any other, you know, race? Is it
Correct.
seen
And
more in the,
yes, it's the slide showed that Black men had the highest prevalence of high blood pressure as a segment on the planet in the world.
in the world? I just think that's so crazy. So,
In the US, the similar disparities exist for other conditions too, like heart disease and diabetes and kidney disease. Of course, they're most highly represented on dialysis.
wow, that was it. I just was just taken back by when you said the world.
Yeah, it's an epidemic, and chronic disease is now on the World Health Organization as a #1 risk to humanity. Chronic conditions, and heart disease is the most common chronic condition.
Mm.
So I think the reasons why are complex, like I was saying, in my practice, even though Black men are highly affected by these conditions, they're also often more burdened with lack of time, lack of resources, and not being able to prioritize their health, being responsible for other people,
Mm.
working hard jobs, shifts that are not allowing them to have a proper lifestyle, and fear of the system leads them to seek help very late as
Mhm.
well. A lot of them have never checked their blood pressure, but they think maybe something's going on in the background, and when they get a sign, they'll go. But the sign usually is the mini stroke or the heart attack or the death. There's no sign beforehand.
Yeah.
It's not like having a rash or having the headache. When it happens, it's for blood pressure, it's actually pretty late.
Mm. That's interesting. Yeah, that was it. I just was like shocked. That I was expecting out of the country, but the whole world is just,
Yeah.
Yeah, that's
Yeah,
intense.
and in the country, the Black women have the second highest burden of disease as a group.
oh, yeah, that was it. Thank you so much. I hope you can come back again. And thanks for offering that link.
Yes, for sure.
Absolutely. You can stop by and see what's happening. The people
Okay.
in that group, some of them are actually doing true transformation, And so you will see some of them are using supplements, some of them are doing the nutrition in a particular way, but some of are just watching and seeing how it's going and learning and asking questions. So it's open to all.
Okay, thank you.
I know that we are coming up on time, but I did want to ask some other questions, unless, other people do have questions, just to be sure that we're covering all the bases, not only for us here, but also anyone that may be watching the replay afterwards. And hopefully we cover some things that may cross their mind. One, I got a couple. I really loved to see the numbers because to me, I think that I'm in my 30s. And so I'm now paying more attention to these things. However, these have always been things. My father has high blood pressure. My brother has high blood pressure, always talking about and around these things. But luckily, I haven't had, at least not yet, any high blood pressure to be mindful of. But to see the numbers, to me, it's almost like gamification to see like, okay, well, if we can adjust these numbers, then, this can knock us down here and then we'll be good. So I liked the approach of how you showed us, very tangibly the things that we can do and what can be seen. And so my first question, because I know you talked about the, I guess I want to call it basic, but that wasn't the phrase that you used. The regular testing that people do, or not people, but your doctor recommends that you do. What would be what should a patient that has these type of concerns go to their primary doctor and ask them about in terms of maybe an expanded view of the testing that needs to be done if they're only going to do regular, like what should they be looking out for and asking them to see if they could include that on their, I think the word is panel.
Mhm. So good question. The reality is right now, a lot of the advanced testings aren't done routinely in the regular doctor's visit.
Mm-hmm.
There are a few reasons for that. One is that most people, if they have perfect looking labs, but they suspect something's wrong, then you seek someone who can do advanced labs for you, perhaps can check inflammation, can check insulin resistance, and can help with putting that picture together. But if the basic labs are abnormal to begin with, let's say there is kidney damage, let's say there is prediabetes, already that's good information and it's good enough to start getting help. And if the person doesn't just want to take a pill, wants to also improve their health, then the primary care may not be equipped to also provide lifestyle guidance. So we have to understand that we have primary care for a specific purpose and they provide specific testing. But anytime you decide as the responsible party for your health to broaden the scope and to deepen the testing, you might have to look at a different provider for that additional testing.
That is
It takes a little bit of time to interpret them. And so in the primary care office where there are, 20, 30 or more patients a day, they might not routinely get those labs done for that reason.
Okay.
Insurance does cover them though. Mhm.
That is very good to know because I know just not even with this, but other aspects of health related things, you think that you're going to the doctor and, well, all of this should have been covered there. And it's not until you see a separate specialist where you realize, oh, so they weren't going to talk about that to me because, like you said, it's not within the scope of what they typically look at. So I appreciate you sharing that. If we still feel that there's something up, but still are experiencing normal test results, that it would be up to us to probe deeper to find, this type of specialist that we're needing. And so happy to have you as I don't want to say the word wrong, intensivist for this
Correct.
because oftentimes you know that you need to be looking for something else, but you don't know who you need to be looking for. And this information, like you're saying, isn't necessarily provided in the doctor's office. And as an intensivist, like, I mean, I guess up next you would probably go to a cardiologist if we didn't know that you existed. But then again,
Correct.
is cardiologist the best bet still or not even because they're not full lifestyle?
There's no wrong way if you are seeking help and you're getting information from different specialists.
Okay.
If what you are looking for is to reduce your burden of disease without adding another pill, then you're looking for a lifestyle doctor.
Okay. That makes
If
sense.
what you're looking for is to restore health without a procedure, literally restore health, then you're looking for a lifestyle specialist.
Mhm.
Now, there's nothing wrong with getting opinions and guidance from the cardiologist and the primary care, but know that you have responsibility for your health and that all your questions can be answered. And now you have another specialty that you can look to for lifestyle related interests.
So good to know. Okay. My next question then is, I know that you said that intensivists don't currently accept health insurance, but I was wondering, are there other avenues of payment that you guys accept? For me, I'm aware of, because I currently don't have health insurance due to the situations at hand. However, I'm familiar with something like Care Credit, or I know some places have FSA, HSA accounts. I'm not familiar with what those that are retired would typically have access to. Can you talk more about the payments that you typically accept to access
Those
care?
are those are all great questions, and what you've listed are all ways that anyone can help pay for their lifestyle care. I personally accept those. The independent lifestyle practitioners, if they are particular about their um, payment plans, you may ask, but I think most cash practices will accept these forms of payments.
Okay, okay. And then just so that our listeners are aware, the care credit is just a medical, or I guess you could say medical related type of credit card. And then your HSA, your health savings account, and then I don't know what F stands for, but your FSA account, those are typically what's offered, as a benefit from your job. So I don't know that that's something you can just sign up for on your own. And so I'm like I said, I'm not familiar with what else, if you may be retired, what you have access to, but those are what are there. And I guess the last question, but not least, or maybe two, what would be your immediate next step for someone that's listened, received this information, and wants to, take charge and do something else? I decided that I don't want to take any more medication. I want to reverse what is happening to me. What should I do now?
Great question. I'd like to highlight something that you said. I decided to take responsibility for my health. We have a disease care system that is going to catch us when we fall. That is what we have. Our health, our health, the health portion of us is our responsibility. It's our responsibility to get educated, to seek, to get answers to our questions, and to keep probing. So, our disease may be the system's responsibility when you fall, but you have to fall for them to catch you. You
Hmm.
have to have a diagnosis or something to be medicated or procedure to be done. If you don't want it to get to that point, you'd like to optimize your health or restore your health, then it is your responsibility. So, having said that, if someone decided that they want to improve their health, the first thing they have to do is actually look at their situation and know what they're suspecting is wrong. So, knowing your number. So, whether it's a visceral fat number or you have been told about a diabetes, or as someone shared, there is a new suspicion of a situation, a diagnosis potentially, and do not stop medication right away without being with a specialist. So don't stop medication on your own because you don't want to take it anymore, because that's dangerous. But once you connect with a provider and begin a walk, then the need for the medication may simply fall off. So first, know your number for what it is that you're trying to fix. Second, usually you're going to be looking for a lifestyle related specialist. And third, ask questions on your wish list for your health.
Okay.
I know many providers, myself included, provide a free consultation, initially. So if someone comes on my website and says, I'm interested in learning about this, I will get on a Zoom call with them and learn more about their condition and then give them options.
Okay, that's helpful. And I love the emphasis on, getting curious and, continuing to ask questions and continuing to seek, because oftentimes you kind of just feel stuck with what you've been told and you don't know where to go next. So that's helpful. I have one more question, but I want to hop to Anika. I hope I'm saying that correctly. Her question here, she's talking about payment. I'm assuming as it may relate to you, Dr. Ashby. How does payment work? Is payment tailored or more like a packaged price?
Usually it is a transformation-based payment, and transformation may be over the course of 4 to 6 months, as you saw, and it may involve before and after labs. And usually the person will either want to be walked through the transformation one-on-one, like you saw these cases that I showed you. There were people who didn't want to take chances. They wanted me to help them come off medication or reduce their stroke risk, and there's no room for error. So that one-on-one guidance is a complete transformation, and that comes in a package. So there are many, many visits. As you saw for the person who had a 16-week walk, it's 16 times that we saw each other in 4 months, over an hour each time. So it could be costly if we charge by the hour. So for somebody like that with a total transformation, it's a package and it's a 6 month walk. Now, with someone who is wanting to dabble and learn a little bit, I have these free programs where you can learn, you can come and go. And then when you decide, okay, this problem needs to be solved, then we discuss a potential program. The idea is that this is not a pill or a shot that you do on the side. It's going to be retraining the way you actually view maintaining health. It's not take a pill and forget it. So because of that, there are at least 2 months of training involved for you to become more knowledgeable so you can navigate this planet and this world and know how to make choices that will be better for your health for the rest of your life.
Got you. That makes sense. Thank
And
you.
are you here in Sarasota?
Yes, I'm in Sarasota.
Okay.
All of my coaching is done online, so anyone in the state of Florida can be my client. They don't have to actually live in Sarasota.
Okay.
And because a lot of what I do is transformational coaching, it is able to be done on Zoom because it's information transfer, knowledge transfer, and then you apply it week by week. You come back each week and we look at the numbers and I give you the next set of information so that growth happens while you are also transforming physically, and you almost don't realize that you've had that transformation when you look back at who you were and what the body was at the time that you started.
Okay.
Mhm.
Okay. Very
Okay.
good. Thank you.
But there's hope.
Yes.
Sure. So I will close out with the last question. I think that this is always, I don't know if the term is fun, but an interesting one. I like to think about what the myths are. I'm a Caribbean person, and if you ask my grandmother, there's a tea for everything. And you just need to drink your tea, whatever it's Cersei or what have you, and that should be the fix. However, we do know the medicine or the tea can contradict your medicine and cause you to have further issues. There's just a lot that can be said about what you ought to do. So, what is a common myth or misunderstanding that you would hope to clear up as it regards to your work?
Well, I think what you just said about the tea, for example, I thought you were going to ask what tea should we take for blood pressure?
What tea can you take for blood pressure?
Um, I get a lot of those questions. But remember, blood pressure is because of stress, inflammation, stiff vessels from cholesterol, so many different things. So a tea is going to be like, well, should I take the lemon water or should I take the hibiscus? And you can take either one, but will either one fix the blood pressure? No. So I get people come all the time and say, well, I've been doing the hibiscus tea, or I've been doing the garlic pill, and I still have high blood pressure. That's the reason why you're looking at lifestyle again as if you're looking at a pill. And this is the reason the pharmaceutical companies created pills, because we have a tendency to just want to take something, forget about the problem. But everything that we're doing in our life is creating the problem.
Mm.
And we don't want to really look at that, but let me just take the tea and keep it moving. So it's just like taking the pills and keep it moving. The tea won't work after a while. Actually, it doesn't work as well. You might as well take your pill.
Let them know. Don't stop taking your medication.
You might as well take your pill. Now, if you have a working nutritional program, then yeah, if you add a little bit of this and a little bit of that, that's how medicine was supposed to be. You have actually your food be your medicine, then yes, within that framework, hibiscus tea is doing its part and it's working. But if that's all you go for and everything else is loaded on, then it's giving hibiscus tea a bad name. It's not going to work.
Mm, good to know. Good to know. Well, I think that was quite a bit of information. We have a lot to just kind of ruminate on as we all navigate either our own health things or supporting other people. That's the one thing that MHI is really big on, is helping people to navigate their health related circumstances, whether it's connecting people to resources or to doctors. And so that's why we have the Healing Circle, to have professionals like yourself just come on and kind of bring us behind the veil as to what we should be paying attention to and being mindful of as we go and try to access limited healthcare that we may not have, the full exposure to, or being given limited knowledge and information that we have to make, really big decisions with. So thank you so much for being here, Dr. Ashby. And thank you for everyone that has been listening and has joined us today, or if you're watching a replay and have made it to this part, I hope that you got all the information that you needed to make wise decision about your health, and definitely reach out to Dr. Ashby using the link that we provide that she's given us to take control of your lifestyle health.